This next test is called the Faber's test. It's used to differentiate pain in the low back, buttock, or groin to try to determine whether or not it's coming from the lumbar spine, the sacroiliac joint, or the hip. You passively flex the hip to 90 degrees and place the patient's foot on the opposite knee. Then you stabilize the opposite pelvis and you let that knee drop out into external rotation. And then I give a little bit of overpressure and you ask if that reproduces their pain. The location of the pain will determine whether or not the pain may be coming from one area or another. If it's in the low back or buttock, typically will be coming from the lumbar spine. If it's in the groin, very often it's coming from the hip. And if it's right over that 14th area on the of the SI region, it's typically coming from the SI. To help further isolate, you can apply a proximal stabilization through the SI just on the lateral pelvis, and then redo the test. And if the patient continues to complain of pain there, very likely it's coming from the hip and not the SI because you're applying a stabilizing force through the SI. So again, this is to differentiate SI, hip, and lumbar pain.